Our new commentary in New England Journal of Medicine, I think, has really one big point, one overarching point, and that is that when public health agencies talk about following the science, typically what they mean is that they're following the epidemiology. They understand the mechanisms of the health problem, and they've got, and epidemiology has told them what we should do to have the strongest impact. But the problem is that epidemiology, while it's necessary, is not sufficient to successful public health, because epidemiology tells you what to do. It doesn't tell you how to do it. It doesn't tell you how to get lots of people to comply with that law or policy. It doesn't tell you how that law or policy should be framed. It tells you nothing about the politics and the cultural issues, the values around that behavior that epidemiology dictates. For that, we need a whole lot of other disciplines. We need law, for one. That's our thrust in the article, but social psychology, anthropology, economics, the whole range of social sciences.
Well, I think that's an interesting point, Scott. I think what you're really saying is you're tying it to a more fundamental issue. I think that epidemiology, as central and important as that field is, it is largely atheoretical. So understanding these mechanisms, how are we going to create the behavioral and systems changes that we need to head off a pandemic? That's the question. And studying those mechanisms and the effects of different approaches, different legal rules, different executive orders, different ways to accomplish that, that's the research that really we need to invest in, as well as just the basic epidemiology and, of course, the biological research and the vaccine research and all of that. We need to understand how we can advance the behavioral outcomes that we want, whether it's masking or getting the vaccine or distancing or changing the practices of bars and restaurants or whatever it is. All of those are pressing questions. And we have the means, we have the scientific designs, we have the means to discover which of those work better and which don't, and what are the underlying mechanisms of shaping behavior of individuals and, importantly, groups of people.
So I guess what we're saying is that the task isn't necessarily elevating one field or discipline over another, but really working to continue to do good transdisciplinary practice, bringing together other fields. It was really interesting to see how poorly the Global Security Index performed. This was an index created in 2019 to rank the preparedness of countries. And researchers have subsequently looked at how those rankings compared with outcomes, and they found a negative correlation. Countries that were ranked as the most well prepared fared much more poorly than countries that were ranked lower. And one of the observations from that experience is that there were lots of important experts involved in the index, from epidemiology, from healthcare delivery, but there were no political scientists, there were no sociologists, and there were no people that could speak to the context in which the epidemiology and the healthcare delivery happens. So I think we're really thinking about how we can continue to lift up social science and embed it with other important health services research traditions.
And I think you put it in there, research traditions. This is, I think, a thrust of legal epidemiology on the sort of practical side, which is, generally speaking, this kind of work is not well funded in America's health research establishment. NIH spends almost nothing on studying legal epidemiology, as we call it, the effect of laws and legal practices on health. And yet, we've seen in COVID that it's a primary concern. And not only do we need research on specific interventions and whether they work or not, as the sort of work that Alex did in road safety and alcohol for many years, we also need basic research on the mechanisms of effect. We kind of default to deterrence. Even in COVID, there were places with big fines, and that was how they were going to get people to wear masks. And we realized, so that's not actually a very strong method of getting mask compliance. We have to think much more about normative mechanisms. And there's all this research and theory, ranging from the theory of planned behavior and how you think about changing people's behavioral intentions, to things like the procedural justice tradition in law and society and social psychology that looks a lot at how people's attitude towards the rule maker will influence their thinking. All that kind of work has got to be, could and should be developed much more substantially as a kind of basic research for behavior change through law and policy.
Yeah, and studying these social and behavioral mechanisms, we have the tools to do it. You know, the RCT, the randomized controlled trial, randomization is just one tool, one good tool, and it works a lot of times. But when we're looking at these laws, executive orders, and things like that, you can't always randomize them to different groups of people. But we have really strong designs with multiple comparison groups, following the situation over a long period of time, doing dose response studies, a whole variety of things where you can have strong studies with strong causal inference in terms of the effects of a particular policy, a particular intervention, a particular order. And we should be using those a lot more. And just because they're not this traditional randomized controlled trial is another part of it. They tend not to be funded, and therefore the research tends not to be done. And then lawmakers and the public and even other scientists are not paying attention to these issues as much as we should.
We've learned that we can bend the cost curve on that type of research if we invest in data. That's a really, I think, important piece of this, because your ability to do those good quasi experiments relies on having good data about the laws that you're studying, and then having good outcome data as well. And that takes an investment. It's not a, it's not necessarily a cost prohibitive investment, but it's an investment that definitely pays benefits.
I think ultimately our commentary is a direct appeal to the research leadership of this country, both the NIH leadership and the important, silverbacks who are, running our big university research centers and operations. And what we have tried to say is there is no scientific reason why we can't know a lot more about how law and other kind of policy mechanisms work. We've shown that. We're talking about cultural change. We will not see the kind of learning that we need, and we won't see the kind of investment we need to produce that learning until people start looking around the table and saying, hey, maybe we should have somebody besides an epidemiologist and a doctor. No matter how senior and no matter how brilliant at this table, maybe we should have some of this wide range of other skills and disciplines that haven't talked about. That has been done in certain narrow areas like tobacco control and road safety. It needs to be done now in pandemic control. And then it really needs to spread out into pretty much every aspect of NIH that doesn't involve a molecule or a bacterium. Anything that involves people, it's going to require research on how people behave faced with these kinds of problems and rules.
Yeah, well said, Scott. I mean, I think this has been a great collaboration with you on this commentary, and let's hope that we have an impact on the decision makers at NIH and in foundations and in the broader society, so that we can advance this science, and through that really advance and head off the next pandemic and treat it a lot better than the way we addressed this one.
I couldn't agree more. And I think, preparing for the next pandemic will also just help us in sort of routine public health work as we work on a multitude of issues.